Great, and then the next second X Prize selected work to come and talk to us because they're kind of doing this. So the X Prize thing had like a range of stuff. We had these kind of disease things in Africa. There was like medical devices and all kinds of systems. And Ellie's going to tell us about their work with opioid relapse assistance.
Hi, so I'm the co-founder and CEO of Behaivior, and my co-founder Ryan O'Shea is down there. And I will introduce you to what we're working on. So what if you could use wearable technology, behavior change techniques, and artificial intelligence to help solve one of society's biggest problems? Imagine if you could detect in advance that someone trying to stay sober from opioids had a higher likelihood of relapsing, going back to using. And imagine if you could detect when someone overdoses to allow for life-saving treatment to be administered before it's too late. This would allow EMS to come or a member of their support network. So we've created a software platform to predict and prevent opioid relapses and overdoses using wrist wearables and AI to provide the right intervention at the right time in real time. Currently, 30 million individuals are struggling with substance misuse, according to the Substance Abuse and Mental Health Services Administration in the US, and almost 12 million of them have opioid misuse. This number is even larger based on the families that are also being affected. Once individuals enter treatment, some facilities offer 30 days, but longer stays prove to be more effective. And the relapse rate for heroin is 90%. So, as many of you know, drug addiction is a growing problem, particularly with opioids. And recently, drug overdose deaths in the US surpassed 72,000 per year. That's higher than the peak deaths of automobile accidents, HIV deaths, and gun violence. And it's not just the US, this is a global problem. And this doesn't discriminate by zip code, income, or career. Globally, 240 million people are dependent on alcohol, more than 1 billion people smoke tobacco products, and about 15 million people use injection drugs such as heroin. So according to the US Surgeon General, the cost of addiction is $442 billion a year. So this includes lost productivity, criminal justice costs, and healthcare costs. So it's significantly impacting everyone, regardless of whether or not they or someone they know is struggling with addiction. For employers, this includes lost productivity and a diminishing workforce. And this also costs governments and taxpayers through recidivism and criminal justice costs. Many people go through painful withdrawals in prison, and they're left with little to no medical or psychological support, and then shortly after, they relapse, usually within about 3 months. The emergency response times are greatly impacted in some areas, with EMTs going from overdose call to overdose call, meaning that their resources are stretched really thin, and care can be delayed, sometimes with disastrous results. This also contributes to the rising healthcare costs and the strains on our system. So when looking at this problem from a design perspective, my team and I started small. We sat in a room for hours with our brains, a whiteboard, and as usual, too few color options for markers. We used our expertise and unique life experiences to craft a solution focused on empowering individuals struggling with addiction to change their behavior with the support of technology. We then spoke to people and organizations that are most affected by relapses and overdoses to find out what their pain points are and how and if our idea could solve those. So historically, the tools used to keep people sober and stay sober have been reactive rather than proactive. They provide help after people start using again or after they overdose. And we have to think about, what about the individuals who don't have the resources to afford the time, space, and access to high-level, full-service treatment? How do they manage their recovery? Access to treatment needs to be democratized, and unfortunately today it is not. So today is a new era of proactive relapse prediction. Wearables, smartphones, and artificial intelligence have all recently evolved, and we're now able to detect that someone trying to stay sober is in what we call a red alert craving obsession state. So this allows us to intervene with the right support at the right time in real time. So how does this work? Through the use of AI, we can psychologically impact behavior change by providing relevant and crucial data to help maintain long-term sobriety and a healthier recovery process. We will detect a number of factors such as heart rate, stress levels, and GPS location. So our proposed solution for detecting a craving state and initiating a just-in-time intervention requires processing multiple real-time sensor feeds through adaptive machine learning models. Our model will examine, among other data sources, the user's physiological data as a time series, and after filtering out noisy artifacts from sensor data and normalizing for the user's baseline physiology, the model will predict a craving state. And I'm going to give you a hypothetical example now. So meet Amy. Amy recently finished a 28-day stay at an inpatient treatment facility because that's all her insurance would cover. This is a US problem. So a few weeks later, her father passed away. Now her sleep's off, she's smoking more cigarettes than usual, she's skipping her support group meetings, she has a racing heart, and she's getting jittery and sweaty. She can't stop thinking about using again. Based on her physiology and behavior, we tell Amy that her patterns resemble a drug craving obsession state. And then we ask her, does she want to do anything about it? Amy chooses to set up a supportive message and photo and phone call in advance, and it's a photo of her daughter. And the message says, I don't want to lose you again. I love you. We then connect her to her 12-step sponsor, and she's able to make it through this relapse mode state without relapsing. The beauty of our technology is that interventions can be completely customized in advance to do whatever people know will help them most in their time of need. And we're utilizing strategies from behavioral economics, motivational interviewing, and cognitive behavioral therapy to help nudge people towards positive behavior change. We'll also detect overdoses to give quicker access to life-saving medications like naloxone. So we can see this in action. If the video works. Okay. The video's not going to work, so I'll just go through the slide images. So this is our web application, which it is working. Okay. We're working on now, so it just has a basic UI for testing, so please forgive the aesthetics. And in this case, we're logging in as Amy. So this is what our dashboard looks like, and here you can see that Amy set a reminder for her next appointment. And what we really wanted to do was build in context to the support system, because that's been shown through research to be very effective in terms of motivations. So for example, Amy can complete the motivational tool here for her medications, and then she'll see a reward. She can also send a text to her support team, who are listed here, and here's an example of the message that has been sent. Amy has just completed a 5-day streak. These are tools that make it easy to incorporate a social support system. And we did want to make this as user-centered as possible, since we know that opioid addiction, it's a very personal and private affair. So we wanted to make sure that the option to hide and unhide information, as you see from the little eyeballs there. Under vitals, so we can see that there's heart rate and sleep and incidence. Things such as heart rate, panic attacks, and sleep problems could be issues that are coexisting with addiction. There's a lot of comorbidity with other mental health issues. So we wanted to build in the possibility for Amy to take action on this information right away, such as by letting Dr. Grayson know here that there have been sleeping issues and perhaps to schedule an appointment. Again, these are things that we can hide and make sure Amy's comfortable with the privacy of her information. On this next panel, I'm just going to skip through the video. We can see that there are trigger updates. Amy can see if there's been contact with a problem person, and she has the option to block calls. It shows the location of available naloxone kits nearby, and these can save a life by reversing an overdose. She can also pull up a map with immediate directions to the nearest locations. And again, we're making it easier to reach out to someone's 12-step sponsors, therapists, and more. And if Amy doesn't have a support group, because not everyone is lucky enough to have a built-in social safety net, we have the option to find additional resources. So this wearable platform technology won't be a sole means for coping with addiction. It will augment it, making other evidence-based treatments more powerful. Like Yo-Yo Ma just said, it's all hands on deck with this problem we are facing, and we can boost the efficacy of existing tools like medication-assisted treatment, cognitive behavioral therapy, support groups, and 12-step programs. Our goal is to be a guardian angel on your wrist to help when people might not be motivated enough to help themselves on their own. And quickly more about us. We're in the top 10 for this milestone of the IBM Watson AI X Prize competition, and we're a graduate of Alpha Lab, a startup accelerator. We're currently participating in the National Science Foundation's Innovation Corps program, which is focused on accelerating the economic and societal benefits of emerging technology, among many other things. We've also recently been awarded a grant from the National Institute of Health, and it's funding an IRB-approved study that we're conducting with our partners, Jade Wellness, with machine learning being conducted through our partnership with the University of Washington and with researchers from Carnegie Mellon University. We're also conducting a wearables 3-phase clinical research study as well, and we won 2 hackathons recently, the Social Justice Innovation Weekend and the Opioid Hackathon in California. Let's see, I'll skip through. We're collaborating with Kevin Stevens, an NHL player. That's really cool. I'm just gonna skip through these quickly because we're almost out of time. I'm a UI UX designer. My co-founder, Ryan, researches the implications of emerging technology and has startup experience, and we're collaborating with a number of very smart people. So this is larger than opioids and larger than addiction. Imagine being able to use this pattern detection, AI, and intervention technology to empower individuals to change any unwanted behavior on their terms in a way that works best for them. So this could be anything from PTSD, suicidal ideation, other addictions, and even overeating and healthy food choices. If we can successfully tackle this opioid challenge, it can be used for other life-saving solutions as well. With AI and human-centered design, we can keep people more engaged in their recovery process and more empowered to help themselves in a way that works best for them. Rather than leaving recovery to chance, we can, in a secure way, use AI and wearable technologies to add a valuable tool to the recovery tool belt. So it's a user experience challenge, and we want to code a shortcut path for them to walk down to make their recovery a little easier. Thank you for your time.
Great, thanks a lot. So if there's time for one question, we probably could. You got it?
Well, of
Can you
course, data protection is really important. We follow HIPAA regulations, which requires very stringent data security to protect people who are patients. Currently, we're working with folks who are in outpatient treatment, so we have protections in place to make sure that everything's good. And they also, everyone owns their own data.
Sorry, no, go.
Okay, I had a little question while they're setting up about if you've looked into anything where you've got the models and the prediction of whether they're going to relapse. Are you going to have any feedback, like feedback into your model and say, well, they found this useful or not, and have it learn and update over time from each user?
Absolutely, yeah. We want everything to be every data point will be used to help make it more effective. So even when people relapse, which is a normal part of recovery, that will add a data point to show us if maybe what other interventions might work better, and where that happens in that stage of recovery.
Okay, great. Thanks. Let's thank Ellie again.
Thank you all so much. Have a good time.